A dental implant is essentially a way to replace a tooth. So when a patient has lost a tooth or had to have one removed, whether it's because of a crack or because of decay, it's essentially a titanium screw that goes into the bone. We allow the tissue to heal, and then a few months later, once everything's integrated properly, we put a tooth on top of the screw. It's able to replicate both the form, meaning the aesthetics, and the function of the bite in a way that's as close to natural as we can get. And in most cases, you can't even tell that it's not a real tooth. The process begins when a tooth is removed. So as soon as the tooth is removed, everything starts to change in that site, which is why it's essential that we do a bone graft in that area. And we place particulate bone matter in the site, and we suture it closed. Usually after that, after 2 weeks, we're able to remove the sutures, and patients frequently note that the post-op is really not very significant at all. A few months later, the bone graft will have integrated, and now we'll have the proper width and height of bone so that we can place the titanium implant. If we don't do the graft on the front end, then we'll lose the width of bone we need for the implant, and so that's why it's crucial that we plan properly and we do things in the proper sequence. But if we do those steps, then typically when we come back a few months later, we have exactly what we need for the implant, and we can place it precisely where we need to based on our 3D planning software.